shall I start?
No, sir. We'll just introduce you and then you can. Okay. Time and health are two precious assets that we do not recognize and appreciate until it is depleted. In wake of the current COVID pandemic, as people maneuver through this paradigm shift involving the new normal, it is vital that we stay calm and make a conscious effort to balance work and life. Respected dignitaries, parents, teachers, and dear students, namaste. Today, we have gathered virtually to attend the session Befriend Your Heart by Dr. Jay B. Pattam. Let's begin today's session with a minute silent prayer. World Heart Day is observed annually on September 29 with the aim of increasing awareness of cardiovascular diseases and how to control them to negate their global impact. This year, the theme of World Heart Day is Use Heart to Connect, harnessing the power of digital health to improve awareness, prevention, and management of cardiovascular diseases globally. We are indeed fortunate to have with us today Dr. Jay B. Pattam, Senior Consultant, Interventional Cardiologist at Renai Medicity, Cochin. Dr. Jay did his MBBS from St. John's Medical College, Bangalore. He completed his MD in internal medicine and DM in cardiology from the prestigious Postgraduate Institution for Medical Education and Research, Chandigarh. He was a consultant interventional cardiologist at Star Hospitals, Hyderabad, and PVS Institute of Cardiovascular Sciences, Cochin, before joining Renai Medicity. His areas of special interest include transradial coronary interventions and pediatric cardiology. We are immensely proud to welcome Dr. Jay, a Bhavanite, alumnus of Bhavans Vidya Mandir, Girinagar. He completed class 12 from Bhavans Girinagar as the second batch in the year 1994. He was an active quizzer and debater during his school days. On behalf of the entire Bhavans Elamakara fraternity, I welcome Dr. Jay B. Pattam to today's session. Cordial welcome to our constant source of guidance and inspiration, our Principal Sunita ma'am and Vice Principal Sri Jyoti ma'am. Hearty welcome to all the parents, teachers, and students of BVM Elamakara. It is my honor to invite Dr. Jay B. Pattam to begin the session. Sir, please.
Thank you, ma'am. At the onset, I would like to thank Sunita ma'am. I was fortunate to have been her student at Bhavans Girinagar. So it's brings a lot of nostalgia to be presenting before her and all of you. So I'd like to thank her and the management of Bhavans Elamakara for giving me this opportunity. So I've titled my talk as Befriend Your Heart. It's just a reminder of the important things that matter to us. I mean, most of the things we are aware of in this digital age where information is available at the click of a mouse. But then we need to be reminded every now and then, probably every year, at least once in a year, what needs to be done and what are the important things to maintain good cardiovascular health. So that's why we have a World Heart Day. So why focus on cardiovascular diseases? As you all know, it's the world's leading cause of death, heart disease and stroke. So together we club them as a broad group called cardiovascular disease or CVD. Now it's important because of two things. One, the affected group are the people in the productive age group. So 1 in 10 of a person aged 30 to 70 years dies from cardiovascular disease. And even more regrettable is that 80% of such premature deaths can be prevented. So it's preventable and it's affecting the productive population of the world. Coming to the Indian scenario, it's actually much worse. If you see, the burden of cardiovascular disease is rising in India, and it's not just limited to the urban areas. Earlier we used to think that heart attacks and heart failure, hypertension, obesity are diseases of the elite, the people who don't work hard or who don't have physical activity and who eat more or are enjoyable to or privy to the privileges of life. But then if you see the prevalence of CVD in rural areas versus urban areas, it's not really that different. And this represents a twofold increase in rural areas and a sixfold increase in urban areas over the past 4 decades. And even more sad is that deaths due to myocardial infarction in Indians occur about 5 to 10 years earlier than in the Western population. So today's talk, I will focus on 3 things. First is, of course, the most important fact that prevention is better than cure. The second is that early diagnosis and prompt treatment saves lives and improves the quality of life too. And finally, since it's after all World Heart Day 2021, a small note on the 2021 slogan and its importance in the current world scenario. So I have borrowed from one of my favorite, every World Heart Day has got a particular theme. So this year it's Use Heart to Connect, but the bulk of my presentation is based on the slogan which came out a couple of years back. This is one of the favorite, my favorite World Heart Day slogans. It has 4 components. The first is know your heart, fuel your heart, move your heart, and love your heart. So coming to know your heart, what are the important things? First, you should know your risk. What is the risk of you as a person or one of your family member developing a serious cardiovascular illness? Know your glucose levels, know your blood pressure, know your lipid profile, and finally know the signs and symptoms of a heart attack. So how high is the risk for my heart? So any man above 55 years of age or women after menopause, when the effects of estrogen go down, a person who smokes or uses tobacco products, people with diabetes, high blood pressure, obese, overweight, with a history of high fat intake, or a strong family history of coronary artery disease. These are the people who are more prone. So coming to the most important risk factor, which is diabetes. Now I chose diabetes because India is known as the diabetic capital of the world. The countries with the largest number of cases in 2030 will be China, the India, and the US. And the prevalence of coronary artery disease as compared to 2 to 4% in the general population is as high as 50% among diabetics. And if you see this particular graph, it's quite clear that if you compare a diabetic with a non-diabetic, the coronary artery disease mortality is much higher. It's more people with coronary artery disease and diabetes die than without diabetes. So why is coronary artery disease in diabetics more dangerous? One, they have more severe disease. When you do what we see usually on angiogram is that they have very small diffusely diseased vessels. So there's a higher prevalence of left main disease, multi-vessel disease, and diffuse coronary artery disease. There's a reduced coronary collaterals. Now, collaterals are important because even if there are blocks, but if there are good collateral circulation, generally people may do well on medical management. But with reduced collaterals or natural bypasses, the problem is they need some sort of intervention. Also, most of them have a larger amount of soft plaques or lipid-rich plaques. So the problem is these are prone for ruptures, and more heart attacks. So that's why coronary artery disease in diabetics is a very dangerous subset. So when should you screen for diabetes? Well, watch out for symptoms of diabetes like increased appetite, increased thirst, urination, or unexplained weight loss. Check a fasting and postprandial sugar routinely after age of 40 years, especially if you have other risk factors like overweight, obesity, high blood pressure, family history of heart disease, or strokes. And if normal, then every 2 to 3 years interval, at least try and repeat the blood sugar measurements. And if your fasting is more than 110 and the postprandial is more than 150, please consult your doctor. In diabetic patients, other than sugar control, one is use of aspirin. If you're diabetic for more than 10 years, or if you have 2 or more additional risk factors, then many doctors may prescribe a small tablet of aspirin. Aim for LDL cholesterol level of less than 100. So most of the time you may need to take statins or cholesterol medications. Target a blood pressure strictly to less than 130 by 80. And do a treadmill test every 3 or 5 years for heart disease detection. The next risk factor is blood pressure. Now always check your blood pressure at least once a year. A normal blood pressure is now fixed at 130 by 80. Earlier, we used to have a higher upper limit for elderly, but as per the latest guidelines, we have kept a set bar of 130 by 80. And if diabetes or kidney disease, aim for less than that. High blood pressure makes you more prone to peripheral vascular disease, to acute heart attacks and strokes. So the recommendation is after 18 years of age, you must check BP every 3 to 5 years, or any symptoms like headache, occipital headache, or visual symptoms, and treat as per your doctor's advice. Ensure salt reduction. Avoid processed foods which contain sodium containing preservatives. Avoid salty foods like pickles, papads, and increase potassium containing foods like fruits and vegetables. And exercise daily. Ensure adequate weight reduction. So these are the recommendations to reduce your blood pressure. Sometimes we think that our weight is okay in the acceptable range, but then in the Asian population, there is also a problem of abdominal obesity and metabolic syndrome. So identify this and treat early. So waist circumference of more than 90 centimeters in males and 80 centimeters in females is a sign of abdominal obesity. Now, I'll just touch upon briefly on a few of the cholesterol myths. Now, we've had a lot of, nowadays we rely on Dr. WhatsApp and Dr. Facebook, and there are a lot of forwards which give us wanted and unwanted information. And cholesterol myths are a favorite source of misinformation, sometimes exploited by people. So I'll just touch a bit on in detail about cholesterol. So what is cholesterol? It's a type of fat which is present in our blood. It's not harmful as it performs various functions in our body. It's a part of cell membranes, it's part of various hormones, but only higher levels of cholesterol in the blood are harmful. So where does the cholesterol come from? Well, most of the cholesterol in your body is made by our liver from various things like fat and carbohydrates in our diet. So the liver synthesizes most of the cholesterol in the body. But some cholesterol also comes from foods such as eggs, meats, and dairy products. And in some instances, these can increase the level of cholesterol in your body. Now I'll elaborate a bit in detail. Are there different kinds of cholesterol? Yes. There is chiefly two different kinds. There's an LDL called low density lipoproteins, which is called the bad cholesterol because it delivers cholesterol to your blood vessels and deposits them inside the arteries, whether it's your heart or your brain or to the peripheries. And there's a good cholesterol called high density lipoprotein, or HDL, which removes cholesterol. It removes it from the periphery into the liver. So that's the good cholesterol. So how can higher levels of cholesterol increase risk of heart attack or stroke? So definitely, contrary to most of the forwards that you have seen, a very high level of cholesterol is not a marker of good health or a good health of your liver. It is in fact one of the main risk factors for developing of significant coronary artery disease, because it can get deposited inside your coronary arteries, inside your peripheral arteries, or in your cerebral vessels, causing narrowing and blocks. So that's called atherosclerosis, or the process by which the plaques accumulate on artery walls. So buildup of the plaque, you can see the lower data, it's a cross section of an autopsy specimen. So buildup of a plaque causes the arteries to thicken and lose their elasticity. So what are the ill effects of atherosclerosis? It can lead to pain in the chest known as angina, can lead to a heart attack, can lead to stroke, and if it's deposited in the arteries supplying your arms and legs, can lead to peripheral vascular disease and may lead to amputations in very severe cases. So coming to frequently asked question 1, does high cholesterol by itself produce any symptoms? A lot of patients, when they come to the OPD, they say that, doctor, I have a pain in the chest. Is it a sign of high cholesterol? No, not really. High cholesterol itself doesn't produce any symptoms in the body. So how to treat and when to take medicines? And once medicines are started, will it need to be taken forever? Well, as a secondary prevention in patients who already have coronary artery disease or stroke or peripheral vascular disease or diabetics, most of the time we have a low threshold to start treatment. So generally start statins earlier. But as a primary prevention, if you don't have any other disease, and if you just come with elevated cholesterol level, we don't generally start statins. We encourage diet, lifestyle modifications first, watch for 3 to 6 months, and only if there are very high LDL or bad cholesterol levels do we really need to start statins. I get people at both extremes. Some who just don't want to take it for the right indications, and the others who want to start it at the drop of a hat. So both are wrong. You need to take it only for fixed indications, true indications. So rely on what your doctor tells you. And once medicines are started, will it need to be taken forever? Not really, except in few situations, like maybe if you've had a heart attack or a stroke, or if you're a diabetic, maybe a small dose of statin may need to be continued lifelong. So is dietary cholesterol good or bad? So that's the $1 million question, and very debatable question. So earlier, there are a lot of guidelines which said that you need to limit your dietary cholesterol to less than 200 milligrams a day. But the current evidence shows that that's not really absolutely correct. Studies where people have been given high cholesterol, in the sense pure cholesterol, 600, 900 grams, have not really translated to increase in cardiovascular disease or events. But mainly because if you increase a dietary cholesterol, sometimes it increases the good cholesterol and the large LDL. It's actually the small dense LDL which gets deposited in the coronaries and in the blood vessels. So dietary cholesterol increasing it does not really translate to increase in LDL or bad cholesterol. But there are two caveats here. One is dietary confounders. There are a group of people who are known as hyper responders. About 25% of the population, if you increase the dietary cholesterol, it translates to an increased LDL cholesterol in their blood. That's about 25%. So there's no way of saying whether you belong in the 25% or not. And the other thing is dietary confounders. See, most of the time, people who eat high cholesterol diet may also be eating high amount of saturated fats. Like if you say if you eat eggs, you eat say bacon, cheese, and other fried things along with the egg, then you are really confounding things. It's not, you're eating high cholesterol as well as high saturated fat. So many of the trials, nutrition trials, found it difficult to distinguish this. People. So it's very difficult to conduct randomized ideal trials where you have a high cholesterol, low cholesterol, high fat, low fat, because generally people who take high cholesterol will be taking high fats. People who take low cholesterol may be taking more of fruits and vegetables. So ultimately the trials would show that a high cholesterol diet is bad. So it's a debatable issue. So how can you bring your cholesterol level down? So proper diet, exercise regularly, reduce alcohol, and follow the medication prescribed by your doctor. And remember, what's good for you, your doctor knows the best. The second aspect is fuel your heart. So this is about eating and drinking provides the fuel for the heart. So try to not eat so many processed and pre-packaged food, which are high in sugar and fat. Now, what's really bad is the refined sugars and carbohydrates. So you need to cut down on the sugary beverages and fruit juice. Choose water or unsweetened juices instead. And try to eat about 5 portions of fruits and vegetables a day. Make your own healthy work lunches at home and avoid harmful use of alcohol. Eat a variety of fruits and vegetables every day because they are rich in vitamins, minerals, and antioxidants. Eat whole grain products, not processed, but whole grain products because they contain a lot of fiber, they contain vitamins, minerals, phytosterols. Choose non-fat or low-fat products and use less fat meats like chicken, fish, and lean cuts. And try to switch to fat-free milk or toned milk. And eat food which offers you extra benefits, which give you more of vitamins and minerals. Another question which I mostly asked in the OP is which cooking oil is the best and is coconut oil safe? Well, earlier we used to say that saturated fats and trans fats increase cholesterol, so avoid palm oil, vanaspati, and what's good is unsaturated fats. But again, now there is a lot of conflicting data which says that probably saturated fats are not really as bad as they are made out to be. And polyunsaturated fats like sunflower, soya oil, rice bran oil, though theoretically they may tend to reduce LDL levels, but they have increased pro-inflammatory effects on the body. So maybe what's sure is that omega-3 fatty acids, that is fish oils, these are the class of polyunsaturated fatty acids which are absolutely safe and healthy for your heart, whereas the omega-9 or omega-6 like sunflower oil, soybean, rice bran oil have allegedly more pro-inflammatory effects, so they are not really as safe as made out to be. And what about coconut oil? So coconut oil is not bad as it's made out to be. If you see the composition of various oils, you see the coconut oil is mainly made of saturated fats. So what goes against the coconut oil, or what was used against it, was that major content is saturated fats and less of unsaturated, so it's bad. But now new evidence has come that fatty acid present in coconut oil is a medium chain fatty acid, which has got a lot of health benefits. It increases the good cholesterol with the large LDL, unlike the other oils. So it's not as bad as it's made out to be. The trick is to basically rotate the oils or use a mixture of oils and use oils in moderation. And also remember, there's about the smoke point of oils. Remember, each oil has got a smoke point where it starts smoking and degenerates. So oils which have a higher smoke point, like canola oil or sunflower oil, these are the oils which you can use for. So, but if you use oil with a low smoke point, like for example coconut oil, at a high temperature when it smokes, the oil degenerates and releases a lot of free radicals. So when you use coconut oil, use it for light sauteing or for dressing for salads. Similarly with olive oil, if you want to deep fry, use oils which have a high smoke point, like sunflower or safflower oil. And what about eggs? In several large studies, poultry is not significantly associated with cardiovascular events. So dietary cholesterol may not be as harmful as we thought. Egg has less of saturated fats. It has got more of pure cholesterol. Egg yolk has also got proteins, carbohydrates, and vitamin A, D, E, and K. And before you egg lovers rejoice, frequent consumer, that is more than 7 eggs a week, have shown to be at a marginally higher risk of new onset diabetes and more CVD events. But on the other hand, higher egg consumption is associated with low risk of hemorrhagic stroke. So eggs are really not as bad as they are made out to be. And the third part, or the most favorite part of the slogan of that year was "Move your heart." So aim for at least 30 minutes of moderate intensity activity, at least 5 days a week. Take the stairs, walk or cycle instead of driving. And always remember that aerobic exercise is especially good to your heart, be it jogging, swimming, cycling, etc. All these are ideal. And the COVID times, when you can't do any outdoor activity, you can always walk indoors or on the terrace, use a treadmill at home. So earlier, I think all of us, probably our favorite time, our family time is indeed the TV time. Mine still is. But unfortunately, this leads to more physical inactivity. Each hour spent per day watching TV is supposedly associated with an 18% increase in cardiovascular risk factors, such as increase in your waist circumference or abdominal obesity, increase in smoking, alcohol intake, and poor diet. So the recommendation is 30 to 60 minutes of moderate intensity physical activity, playing a sport, brisk jogging, swimming, at least 5 days of the week. And if you really want weight loss, then it has to be at least 60 to 90 minutes. And in children, more than 1 hour per day of strenuous physical activity with less than 2 hours of leisure screen time, and less than 2 years of age, no leisure screen time. Now in the corona period where our kids are all glued to their TV screens, hopefully there's an end to it by next year. And the last point is love your heart. And by loving your heart, I meant quit smoking. Smoking is one of the most dangerous risk factors, responsible for about 21% of strokes, heart attacks, and nearly 60 to 80% of various cancers of the oral cavity, esophagus, and lungs. So quit smoking. And within 2 years of quitting smoking, you can see that the risk of coronary artery disease substantially reduced. And within 15 years, the risk of cardiovascular disease returns to that of a non-smoker. And the various tips to stop smoking: take a strong decision. The important thing is to take a decision to quit. Try to take help from family and friends. If possible, find someone to quit smoking with you. Try spending some time in the company of non-smoking friends. Change routine activities which prompt you to smoke. Write reasons for quitting and read them regularly. And nowadays we have a lot of medical assists like nicotine gum patches, some new drugs which can help you give up smoking. And do not give up trying, but remain determined. Another frequently asked question is, isn't alcohol good for the heart? Not really. Alcohol raises your blood pressure, makes you more prone to cardiac arrhythmias or fast heartbeats, higher risk of strokes, not to mention the social problems and neuropsychiatric issues. Now, there was some data which showed that it may increase the proportion of good cholesterol, but there's a lot of bad things which, so I wouldn't really recommend anyone to start drinking if you won't. But if you're unable to stop drinking, you need to limit it to less than a drink a day. What about diet supplements? We have so many diet supplements available online. We have vitamin D, E, trace elements, minerals. So has it really shown any benefit? So if you see, probably only fish oil supplements, has really shown a benefit in reducing CHD. And maybe nowadays there's some data coming about vitamin D deficiency and increased risk of CHD, and how correcting that may actually help. But if you look at the other factors, though they have been associated, deficiency of say vitamin B6 also has been associated with more CVD events. Correcting the vitamin C deficiency has not really been shown to reduce the cardiovascular events. So it's probably more of an association rather than the causation. So I hope I have covered the 4 points: know your heart, fuel your heart, move your heart, and love your heart. So you can stay young at heart. Anything more to be done? Yeah, you can check. You do a non-invasive test for inducible ischemia. Basically, a simple way is to go to any hospital and get a treadmill test done, or a suitable stress test if you can't walk, to evaluate your risk of coronary artery disease. So coming to the part 2 of my presentation, which is the early diagnosis and prompt treatment. So how do you know that you're having a heart attack, and what should you do? What are the classic features of angina or the cardiac pain? Usually it's located over the sternum or near to it, a small area of the chest less than 3 centimeters, or entire left side, radiating to the left shoulder, arm, jaw, or maybe to the back or to the teeth. It can range from seconds to hours. And sometimes it's described as a stabbing, sharp pain, knife-like pain, or sometimes gas. It's usually triggered by exercise, heavy meals, cold weather, and body movements. Always remember that women, elderly, and diabetic people can have silent heart attacks. So they can have atypical symptoms. It may be just indigestion, gas, shortness of breath, or just fatigue. So what to do next? One of the most critical things is use of an aspirin tablet. Always remember to chew the aspirin tablet and not swallow. And remember, in a heart attack, the time is muscle. So get to a hospital first, get to an emergency room. So I'll just familiarize you as to what happens in an ER when you come with a chest pain. Your ECG is usually taken. Serial ECGs are taken at 1 hour intervals. And if your pain is quite typical, we do a test called a troponin, which is a cardiac enzyme checked in the blood to assess the possibility of you having a heart attack. Never leave the hospital until at least 2 or 3 ECGs have been shown to be normal and your symptoms are better. Possibility 1, that you are not having a cardiac pain. So that's the best possibility. So 2 or 3 ECGs are taken, they are normal, and you are discharged. Your doctor may advise you to go for a treadmill test the next day on a routine basis in the OPD, just to be absolutely sure. Possibility 2, your ECG shows some mild changes and your enzymes troponin may be mildly elevated. So your doctor may admit you, start you on blood thinning injections and tablets, and you may be advised to undergo an elective angiogram the subsequent day. But that is also not an emergency. A possibility 3, and this is most important, is ST elevation MI. Now, if your doctor mentions to you that you have an ST elevation MI, that is a serious diagnosis which requires an immediate coronary angiogram followed by revascularization. It may require angioplasty of the occluded artery. It means your artery is totally occluded. So if any other possible mild ECG changes or suspicious ECG changes can all wait. But if you have an ST elevation MI, then it's always best to undergo an immediate angiogram followed by angioplasty. But even in the best of centers, despite best intentions and efforts, sometimes patients don't make it. But remember that that is no one's fault. Despite best efforts, we may not be able to salvage each and every case. Coming to the third part, that is the World Heart Day 2021 and the theme of this year. Now, this year's theme is use heart to connect. Now, what does that mean? Are at a greater risk of heart disease and stroke due to lack of access to cardiovascular disease prevention, treatment, and control. This is important in the COVID scenario. the world was people were being more vulnerable and it's complicated. So when they are stuck and they have no contact with friends, relatives, they may miss.
Ganga, what happened?
I think ma'am, some network issue
got-
for him. Sir,
Sir, was there a network issue?
You are on mute, sir. You are on mute.
Am I audible now?
yes, yes, sir.
Yeah. Okay. So there are three parts to this particular motto of use hearts to connect. The first is equity. So use of technology and data will help us bridge the gap and do it fast. So it's all about enabling and empowering everyone everywhere. Whether it's young or old, students or teachers, women and children, doctors, community workers, patients. We need to use digital tools for better prevention, diagnosis, and care of heart-related conditions. The second is use of digital tools, to set a healthy heart diet. There are many tools like wearables, watches, smart watches, which can track calories that you take, the steps that you take in a day, the calories that are expended. So encourage people to use this to sort of improve their heart health. Have good telemedicine facilities, so encourage people to use them. If they can't physically go for their appointments, at least get a telemedicine consult with their doctor, so that their health is well taken care of. And the third aspect is at the community level. The issue of isolation of these patients, they're more prone to psychiatric issues, depressions. So encourage use of digital tools so that they can connect with their family, friends, relatives, and doctors. So that's the relevance of the motto, use heart to connect. I hope I have been able to put across the message of this year's World Heart Day. Now we can maybe go to a few questions. You can put it in the chat box or you can ask directly.
Thank you, sir, for giving us an insight into the actions that we can take to avoid risk factors and also to prevent and control cardiovascular diseases. Thank you, sir. Let's now move on to the interactive session. Dear parents, teachers, and students, you can unmute yourself and interact with Dr. Jay, or you may also post your queries in the chat box. Gangama's chat box is enabled, no?
Yes, Sumi.
Good evening, doctor.
Yeah,
Doctor,
good
I
evening.
have a doubt. We as students these days are overstressed, and the workload and time-bound submission, because of time-bound submission, etc. Also, we get less sleep, and hardly 4 to 5 hours we get to sleep. And we also have this irregular time pattern. Basically, the biological time is totally wrong. I mean, yeah. So how is it gonna affect us as teens? What are we prone to?
Sleep is really important. You need to get at least 6 to 8 hours of good sleep at night. It has been shown that increased stress and lack of sleep can lead to one, hypertension, increased blood pressure. Sometimes stress can increase blood sugar levels. So definitely these are things that need looking into, both at the parents level as well as the school levels, and you need to reduce the stress on kids. Yeah, definitely. Another thing is the use of screen time. But again, in view of the COVID scenario, which is, I think, hopefully changing now, the increased screen time and lack of exercise and physical activity is also another important aspect that's worrying.
So there is a question in the chat box.
Yeah.
Is there any risk for administering COVID vaccine on a person with cardiac ailments, especially artery blocks?
Yeah. There is routinely no contraindication to administering COVID vaccine in a patient with cardiac ailment. Only people who are on oral anticoagulants. Now, those are very strong drugs to prevent clot formation. They are generally taken by two group of people, one who have had valve replacements and some people who have an irregular cardiac rhythm called atrial fibrillation. Now, these are the two kinds of people who will be on oral anticoagulants. Now, these people generally ask them to their blood becomes a little less thin. But apart from that, patients with coronary artery disease or post-angioplasty, recent heart attacks or strokes, there are really no contraindications. You can safely take the COVID vaccine. There is a small subset of people who develop thrombotic complications with the COVID vaccination, but it's a very, very small percentage. And the benefits of the COVID vaccine are much, much more. So we should not stop the occasional reports of the clotting events from you taking a potentially life-saving immunization.
Sir, is there any risk in using refined oil on a regular basis? Another question. Refined oil.
As I said, it's important to use a rotation of oil. It's not the kind of oil, but more the amount of oil. So use oils in moderation. What's recommended is use only less than about 5 teaspoons of oil per day per person. So that's the recommended allowance. Earlier, we used to, support the use of polyunsaturated fatty acids like oils like sunflower oil over coconut oil and say that coconut oil is bad. But now the data is showing that coconut oil has a lot of medium chain triglycerides which have a lot of health benefits. So it's not really bad. So it's any oil you use it in moderation, but I wouldn't really recommend one oil over the other.
Okay. Another question is, some people die when they are working out, either due to heart attack or stroke. What can be the reason for that?
Yeah, so there are, these are called sudden cardiac deaths or SCDs. Now, there can be two reasons chiefly. The most common reason would be an cardiac arrhythmia or an abnormal heart rhythm. Now, this can be because of either coronary artery disease or blocks in their arteries, or it could be due to a genetic susceptibility to developing these kind of arrhythmias. There are some various conditions like heart muscle, some cardiomyopathies, hypertrophic cardiomyopathy or dilated cardiomyopathy, or some channelopathies, which are genetically linked to increased preponderance to cardiac arrhythmias. So the most common cause of such sudden cardiac death are such cardiac arrhythmias. So how can you prevent that? Well, one, before you embark on an exercise program, it's always better to do a basic cardiac checkup, like do a basic ECG, check an echo for any structural heart disease, and also do a treadmill test. So which will show whether you have any chance of developing coronary artery disease. So once an echo, treadmill, and an ECG are normal, you can most safely embark on your exercise program. And people with a family history of sudden cardiac death, these are the people who may be having a hidden channelopathy or a heart muscle disease. So it's always better to get a cardiac checkup before you embark on an exercise program.
It is said that hereditary is a major factor for getting heart disease. So how far is this true? That's the question.
Ma'am, what's a major factor? I didn't hear your question.
Heredity.
Heredity. Yes. Yeah. So it's one of the risk factors. History of unexplained coronary disease in male less than 45 and lady less than 55 years, and history of coronary disease in first degree relatives, father, mother, brother, sister. These are the if you have such a history in your family, then definitely it is deemed as one of the traditional risk factors.
Okay, sir. Another question related, somewhat related to the previous one, having cardiac arrest while doing exercises. So the question is, what kind of exercises would be safe or better for heart? Is it heavy workout or yogas? That's the question.
Yogas are mostly safe, probably the safest exercise to do. But if you are embarking on a more strenuous program, like if you are planning on jogging, running a marathon, or playing, even at amateur level sport, it's always better if you are more than 40 years, first get a treadmill and an echo done before you start such programs.
Okay. Next question is from a badminton player. As an exercise, how far is playing badminton good? That's a question.
Yeah, it's good. Again, there's been a few controversies because there have been a few deaths, in people playing, sudden deaths, and but then it's not really. It's probably the sudden movements as well as the sudden fluctuations in heart rate, which are associated with badminton, that may cause a plaque rupture or cause an arrhythmia. So if you plan on playing badminton, at least in a professional way, or in a regular basis, it's always best to get a cardiac checkup prior to that, and at least get a treadmill and an echo done every 2 to 3 years if you are continuing a daily sport like badminton.
Okay, thank you, sir. Next question is on COVID and heart disease. So, any precautions to be taken for heart after COVID recovery? And also, how much are these COVID-19 survivors vulnerable to heart diseases? That is the question.
Yes. So we are seeing a lot of COVID cases at RINAI, and what practically we see is that there are many people who present with clotting complications after COVID. Now, this may not be immediately after COVID, but up to 1 to 2 months post COVID also, we see people coming with clots in their veins, clot in the coronary arteries causing heart attacks, clots in the peripheral arteries. So generally but these are usually people who have had category C COVID or more complicated COVID infections, where the inflammatory phase has been prolonged, and these are the kind of patients who are more prone to develop these kind of clotting complications. So generally we monitor the D-dimer of such patients when they are admitted, and if they are higher than a particular level, we start them on oral anticoagulants or medicines to prevent clot formation, which we give for about 45 days. And or a new restlessness, swelling in the limbs, or any blackening of the extremities, definitely he should report to his doctor. And there are some routine post. Generally, we advise an X-ray and sometimes echo and an ECG, just to make sure that COVID hasn't really affected the heart or other organs bad.
Does having a family history of cardiovascular disease affect future generation? I think we discussed a similar question.
First degree relatives, parents or siblings.
Okay, sir. Another question is again on oil. Can we use different types of oil for cooking, or should we stick on to the same oil?
Well, use things in moderation. That's all. You can change the oils. There's no rationale in sticking on to one oil. You can generally olive oil, fish oils, coconut oil. These are have benefits also. So you can use one of these oils. But then whatever oil you use it in moderation.
Okay. During a normal health checkup, it was found that some artery congestions or possibilities. Can angioplasty be adopted as a regular activity to stop a heart disease or such congestions?
Regular checkup by what was the test? It's usually we do a treadmill test or some sort of stress test to evaluate the possibility of you having coronary heart disease. These are non-invasive tests where you don't put a needle in, or it's a non-invasive test done on OP basis. Generally, if they suggest that you may be having a possibility of coronary heart disease, we usually confirm doing either a coronary angiogram, or you can also do what is known as a CT coronary angiogram. It's just like a normal CT scan. So that also will show whether you have blocks or not. And only after ascertaining that you have definite blocks, do you need to even consider the possibility of a angioplasty or a bypass or some other revascularization.
So next question
That is an elective case, an emergency or a sudden heart attack or something.
Okay. If a person at 50s is having a block in heart, whereas his BP, cholesterol, sugar level, everything is normal, what could be the reason for getting the block?
Yeah, so the conventional risk factors, diabetes, blood pressure, smoking, dyslipidemia, these are the conventional risk factors. But then we are seeing a lot of youngsters or maybe younger people in their 40s and 30s coming with coronary artery disease. It's difficult to explain. Some may have a strong family history. Again, the family history, what is the thing which causes the blocks? We really don't know, some unexplained cause. And the second thing must be the increased stress, and stress levels also in today's world definitely need to be looked into as one of the causative factors for acute coronary syndrome.
Is there a risk of COVID-19 in heart patients? Is the risk higher? Probably that was the question.
The people with heart disease have a risk for having more serious complications of COVID. It's not that they are more prone to COVID, but if they get COVID, they are likely to have more severe forms or complications of COVID.
Okay. The next question is again on inherited cardiovascular problems. So what percentage of people with inherited cardiovascular problems have a higher risk than others? And what precautions can they take?
Yeah, so inherited, I suppose you mean one heart muscle disorders like cardiomyopathies, like maybe hypertrophic cardiomyopathy or some sort of dilated cardiomyopathies. The other disorders which are probably heritable are channelopathies. These are make a person more prone to cardiac arrhythmias, sudden variation in heartbeats which can cause sudden cardiac death. They are very rare, but we do come across. So I can't put a definite percentage or figure on that, but they are quite rare, but very much a fact. So channelopathies and cardiomyopathies, these are the heritable conditions which cause cardiovascular issues.
Some people take supplements like vitamin C, B and all. And if a person overtake the supplement, is there any problem? Over intake of vitamin supplements.
Yeah, but generally, vitamin B and C are water soluble vitamins. So generally, there is not much permanent harm in taking more of these. They won't get accumulated in your body, but they can cause, maybe vitamin C above a particular level can cause gastritis and the gastric symptoms, but no organ damage that I know of. Vitamin A, D, E, and K are fat-soluble vitamins, and these can, if taken in abnormal amounts, can cause overdose and hypervitaminosis. So you must be careful about what supplements you take and what dose and how long you are taking.
Okay, sir. There is one more question in the chat box. If the HB
And as
level,
I said earlier, probably there's, apart from maybe vitamin D, there's not really much evidence.
okay, if the HB level in the blood exceeds the maximum limit, does it affect the normal functioning of the heart? And if so, how can HB level be reduced?
Yeah, so anemia is basically a reduction in hemoglobin. Hemoglobin is what carries the oxygen to your tissues. So definitely, if there is a low hemoglobin, it can affect the tissue oxygenation and can lead to, you know, more heart failure, heart attacks, and you need to correct the hemoglobin, or anemia as we call it in medical terms. So correction of anemia is important in cardiovascular conditions. You need to maintain a hemoglobin at least level.
So here the question is if it exceeds the maximum limit.
Okay. Right. So that's what you're talking. Yeah. So what you're talking about is polycythemia. So definitely, if the HB is more than say 16, that a common scenario that we see in smokers. So they have a very high HB. So this tends to make the blood thicker or more viscous. Obviously, more prone to clotting and reduced and increased incidence of strokes and heart attacks. Yeah, it is one of the risk factors for developing heart attacks and strokes.
Any more queries, parents, teachers, or students?
Good evening, doctor. May I have a question? Doctor.
Yes, Kripa, continue.
Okay. So, doctor, my grandfather just had his bypass surgery last year. So after that, he says that he feels some sort of heaviness in his chest. So is this common? Is this a common issue to all, or what can be the reason behind this, doctor? Oh.
1 minute, I think.
Okay, miss.
Doctor has lost the connection. Ganga miss.
Yes, John. He seems to have lost his connection.
Doctor's here. Yeah. Kripa, can you repeat the question once more?
Yes. So, doctor, my grandfather just had his bypass surgery last year. So after that, he says that doctor, can you hear me?
Is the doctor still on the call, or has he lost his connection? He's on the call.
He's in the call. He's here.
Doctor, did you hear her question? I don't think he's able to hear it. That is why.
So you're muted, sir. Please unmute.
You are muted.
I missed the question. Can you repeat it, please?
Yes, doctor. So my grandfather had his bypass surgery last year. So after that, he says that he feels some sort of heaviness in his chest. Heaviness. I don't know what is the reason. Is this a common issue for all, or what can be the reason behind this, doctor?
Okay. Yeah. So the important thing is to rule out whether he has a new coronary problem. Sometimes what happens is you can develop reblocks in the grafts, or you may have even develop a new block in a vessel that has not been grafted during the bypass surgery. So if the symptom is exertion, like if it's when he exerts himself, when he walks, he climbs steps, or after taking a meal, you need to then rule out the two problems which I had mentioned. But if it's say more like positional, when he turns, bends, it may even be a muscular pain. So your doctor who you're routinely consulting would be the ideal person to evaluate these things and determine whether it's something that needs to be looked into, or maybe unrelated and to any heart related. It may be just a muscular pain or a non-cardiac issue.
Oh, oh, okay, doctor. Okay, okay. He just felt this after the surgery. The next day, from the next day onwards, he started feeling this sort of heaviness after his surgery. So
Yeah. Sometimes people are on aspirin, it's a blood thinner, that itself can cause a lot of dyspepsia and gastric symptoms. So that also maybe, if it's there right from the initial day, it may be even be related to the medication and sort of dyspepsia related to the medications.
oh, okay, doctor. Thank you, doctor.
You're welcome.
Sumi, have we come to the end of questions?
Yes, I feel so much.
That was quite a number of questions. Yeah.
Okay, so with this, we have come to the end of today's session. I call upon my colleague, Ms. Reshmi Raghunath, to propose the vote of thanks.
As we express our gratitude, we must never forget that the highest appreciation is not to utter the words, but to live by them. Respected Chief Guest of the Day, Dr. J.B. Pattam, Senior Principal Srimati Sunita S., Vice Principal Srimati Srijyoti N., parents, teachers, and my dear students, Namaste and a warm good evening to everyone. It gives me immense pleasure to propose the vote of thanks on this occasion. I would like to express a heartfelt gratitude to Dr. J.B. Pattam for taking time off his hectic schedule and sharing his thoughts on Befriend Your Heart. It was indeed an enriching and informative session. Thank you, Doctor. I extend my sincere gratitude to our Principal Srimati Sunita S., Vice Principal Srimati Srijyoti N. for their wholehearted support in the organization of this workshop. Thank you, ma'am. Thank you, Srijyoti, ma'am. On behalf of Bhavans Vidyamandir Elamakara, I convey our profound thanks to all parents, students, without whose presence and support the program would not have been a success. Once again, thank you all. Thank you.
Thank you, Reshmi. Life is more beautiful and fun when we have a heart that beats right. Let's connect with our hearts, make sure we are refueling and nurturing them as the best we can, and using the power of digital to connect every heart everywhere. Thank you.
Thank you, Jay. Jay. He lost the connectivity, I think.
He had some connectivity issues towards the end.
Yes.
Yeah, all the others can leave the call, no? All the others.
Hey, thank you. It was one good, very informative. You lost the connectivity, Jay?
I think he's lost it, madam. He's lost the connectivity.